Welcome to BDCAdvisors.com. I'm Neal Hogan, a director here at BDC. In the next couple of minutes, I want to briefly describe a response that we have to a common question we hear when we're out working with clients, boards, executive teams, and members of communities. And that is, if you look at healthcare reform today, what's really the difference between what we're seeing today and what we saw in the 1990s? With an implication of, do we really need to change? We think there are 6 major differences between what we saw almost 20 years ago and what we're seeing today. First and most significant is health reform passed. Love it or hate it, the Accountable Care Act did become law in 2010, and while elements may be pulled back, we think the fundamentals of delivery system reform will remain intact. Insurer reform, issues around whether you're going to be compelled to purchase insurance, whether we're going to subsidize Medicaid and so on, that may waver, but we think delivery system reform is here to stay. Second, and this is a reason why it's here to stay, our deficit is so dramatically worse than it was 20 years ago. I don't think I need to explain that anymore. Everyone knows. Third is an imbalance. While wages were different 20 years ago, we saw lows and highs, we saw the wealthy, and we saw the beginning of an expansion between the wealthy and the middle class. It's really radical what's happened in the last 10 years. Median wages for the average worker in the United States have remained absolutely flat for the entire decade. So in 2000, median wages were about $50,000 a year. 2010, $50,000 a year. At the same time, as we all know, healthcare expenditures have gone up dramatically. So the country cannot afford the depth of the deficit, a big part of which is generated by Medicare and Medicaid. And individuals cannot afford the rising cost that they have to bear for health care compared to their median and flat wages. Fourth is, while we saw a tremendous amount of conversation around cost control in our debate around reform, and that is a big piece of it, as I just pointed out, the really interesting part that's different from the 1990s is a focus on quality. This isn't about gatekeeping or preventing people from getting somewhere. It's really about using tools that we have today to do a better job of managing the most expensive care that we deliver, particularly for chronics and multi-chronics in the elderly. And we're allowed to do that because of number 5, and that is IT. Information technology in the early 1990s was vastly inferior to what we have today. Just pull out your iPhone and you'll know the difference. What we can see today with EMRs, disease registries, data warehousing, data mining is phenomenal compared to what we could do in the 90s. And that's going to allow us to address the value equation in a much more sophisticated way than we could have 20 years ago. And lastly, innovations in care delivery. If you look at care management, disease management, patient-centered medical homes, and so many other elements of the way we deliver care that didn't even exist in the 1990s, you'd be impressed. And you'd realize that we have a very good chance to improve the value equation if we can shift the way we are fundamentally paid. Rather than per unit, to do more units, but instead for a broader base of care through value-based payments, bundled payments, and some sort of global payment even. All of these will be experimented with under health reform, and they're the fundamental differences that we see between 1990 and 2011. Thanks, I'm Neal Hogan, BDCAdvisors.com.